Well, hello. Thank you for joining us. So today I'm with a patient, David, and he's going to share his success at our clinic. So thanks for joining us.
Good morning. Not a problem.
So tell us a little bit about what type of problems you came in with.
Well, I kind of I kind of had a double whammy when I came in. I had been struggling with Meniere'S for 20 years or more. And if you've never had that, it's sometimes been called a curse, and it really could be, because it's just it can be so problematic with the symptoms that occurs within the inner ear, and the vertigo that could come with that, and the tinnitus and all these things. And so I've tried so many different things. I tried prescription things, I tried herbal things, I tried physical therapy, I tried balance, exercise, I did everything. Didn't seem to get a whole lot of relief. So not only did I have that problem, but I also had fallen and injured my back. And after that started healing up, because all the pain was in my back, I noticed that my neck just felt awful. So I remember meeting you back several years ago at the Stow Chamber of Commerce, sitting at your table, and you were talking about your process and your procedure, which at the time I thought, well, I don't need that per se. But then as I was looking at neck pain and things and what could have been, all of a sudden I just happened to come across this whole idea of this cervical chiropractic, the whole neck, upper neck chiropractic. And I go, well, and I said, I remember meeting Jeff at the gym. Sure enough, your practice pops up. And so I said, you know what? And then I noticed, because I originally was looking for the neck, then I noticed this mentioning of Meniere'S, and I go, whoa, all right, I'm going to try this. Right. So I came for the initial thing, and then we did the initial x-rays, and I saw how messed up my neck was. And I think it was like, 110 degrees out of whack or something like that. That was really bad. It was like 8 or 9, 6 or 7, 8. And when I saw that, I thought, oh my gosh. And then, so I started the process and the procedure as kind of, and when you described the fact, you said, now here's what's going to happen. You said, this is really going to be underwhelming. Right. I'll never forget the word underwhelming. And so when we started the process with the, in the neck, I thought, is this really going to work? But then over time, and that's what it was, and you said it's going to take time. But over time, yeah. And this whole past, oh my goodness, almost this whole past year, especially into last winter, my Meniere'S symptoms have been very, very, very minimal. Whereas before I would have major problems. Now I could maybe feel it coming on, but all of a sudden it would just sort of stop and just sort of hang on, and then a day later I wouldn't have anything. And this was wonderful. And it was like, wow. And then my neck feels 100% better. I don't have the pain. I can actually twist it to look and see if cars are coming when I want to make a left-hand turn, which is really important when you drive. So yeah, it has made a big difference. It's made a huge difference.
Excellent. And you mentioned even the earring component,
which
which I wasn't sure about. That's one of those I'm not sure if it'll help sometimes. The 4 symptoms of Meniere'S, the whole thing with the tinnitus and the dizziness and the fullness and the hearing loss are not nearly what they were. There is vast improvement, 75% improvement in that. Well, that's excellent after 20 years or so of a problem. So I think it even surprised me, how well you've done. Yeah. Well, I think you covered all the bases, and sharing your story. I appreciate you encouraging other people. As you know, there's not a lot of hope for people with Meniere'S disease. They often don't know what else they can do.
And I tell people, I say, you ought to try this. Right. And I say it's going to seem kind of underwhelming, but you ought to give it a try. Right. And so it's worked for me. That's what I can say.
Well, awesome. Well, thank you, David, for sharing.
Sure.
Yeah, encouraging other people. Yeah,
good.
All right.